It's Atch back with another health highlight from Michigan Primary Care Partners and Y102, and this week's topic is your gut health. Now, when you think of your gut health, you just think of, oh, well, everything's working fine down here. I put my food in my mouth, chew it up, goes to my belly, comes out, and we're good. Well, you ever had gas? You ever had something that feels like just a really bad pain in your stomach and you can't explain why when you eat certain foods? Have you had your immune system maybe not working as well as it has in the past? Maybe when the kids go back to school or something like that, or with this whole coronavirus thing, you start thinking of your immune system, you know? So where do probiotics play a role in all of this? What are they? Because for many of us, it's just a simple pill bottle that's got some pills in it. We just go, oh, I don't even know what they do. Right? So how do they work? How much should you take in capsule form? Because that's another thing. When you go in there and you read the label, it says billions of, enzymes or whatever, billions of probiotics and different kinds. And you're just reading like what kinds, you're like, I don't know what any of this has to do with, right? Also, who should be taking probiotics? Also, who should not be taking probiotics? And how does it help your overall health? And how long should you be taking it for? That is what we are going to tackle in this week's Health Highlight with Michigan Primary Care Partners and Y102.
Probiotics are very, very helpful for people with IBS. I have people who have been labeled as IBS, and I would say that probably about 40 to 50% of those people that I see that have IBS are improved with probiotics, and sometimes the IBS even goes away. It's supposed to be also very good for people who have constipation or diarrhea, and they've used it in nursing homes to try to help with elderly folks who have problems with their bowels. With so much use of antibiotics nowadays, a lot of people are deficient in probiotics in their gut, and it's actually also something that boosts your immune system. So I think that that's a really excellent thing to use. I think that even somebody who takes an occasional antibiotic could probably use a probiotic. I usually recommend something with at least 2 billion colony forming unit CFUs in it, and also with as many different biological organisms as possible, because that's what the gut is all about. It's kind of a diversity of different bacteria. If somebody's going to take a probiotic, yeah, you have to take it for at least a month to see some improvement. So I would certainly have them take it daily for at least that long. I'm not sure I would give it to infants, but even children get a lot of antibiotics. So I think if they have those kind of exposures, then they could certainly take a probiotic as well.